Hello everyone, I'm Jane, and this is the CareSmartz360 Bulletin. A major development shaping rural healthcare is moving through the policy lane. The U.S. Centers for Medicare and Medicaid Services is earmarking a staggering $50 billion under its Rural Health Transformation Program, a capstone effort aimed at boosting healthcare access and outcomes in rural communities. But as this funding window opens, voices from the home health sector are urging CMS to place home-based care at the forefront of the plan. From the front lines of advocacy, the National Alliance for Care at Home emerged with a pointed message for CMS Administrator Dr. Mehmet Oz. Prioritize in-home services as a core pillar of rural health sustainability. In a letter sent last week, Alliance CEO Dr. Stephen Landers described home-based care as essential for delivering consistent clinical and supportive services in the home, especially as rural hospitals and clinics grapple with closures and service reductions. The Rural Health Transformation Program is pitched as a vehicle to improve outcomes and access in rural settings and is tied to the broader One Big, Beautiful Bill initiative. Alliance leaders emphasize that home-based care can address stubborn rural barriers, transportation gaps, care continuity, and the capacity crunch facing hospitals and emergency departments. But the push comes with a note of caution. Rural home health providers already face financial headwinds, declining Medicare reimbursement, Medicaid payment rate pressures, ongoing workforce shortages, and escalating administrative demands. The Alliance says RHTP funding must cover home-based agencies, staffing, technology, and telehealth infrastructure to stabilize and grow this critical care model in rural areas. Echoing the call, advocacy groups like Hearts for Homecare and Bayada's leaders stress that home health must be embedded in the rural funding strategy to prevent further hospital and nursing home closures and to ensure cost-effective, patient-centered care outside hospital walls. Industry executives see opportunity here as well. David Kearns of the LTM Group frames the program as a potential springboard for partnerships. Hospitals, health systems, and state associations collaborating to deliver hybrid care models that blend in-person visits with virtual care, chronic care management, and navigation services. Looking ahead, supporters say this funding can reframe rural health, extending care beyond traditional facilities. Strengthening access to home-based services could reduce unnecessary hospitalizations, improve outcomes for chronically or seriously ill patients, and support family caregivers, all while keeping dollars circulating within rural communities. That's all for today in the CareSmartz360 Bulletin. See you soon. Until then, have a great day.